Jane Derenowski, Kerry Sanders from NBC, thank you very much for keynoting this morning. Let's take a couple of questions. Jane, don't go away. Please come back. Kerry, please stay for just a second. I don't see a hand. Let me ask one. Oh, wait. Go ahead, Elizabeth.
Thank you. Two questions, and actually one. Kerry, you talked about we called for help when you were on one of your stories. I think it was actually the Kosovo story. You talked about you actually made a call for help. So I wondered about sort of involvement in those stories. Like that's that funny line of when are we observers and when are we involved? And then for both of you, I felt like a lot of what we were looking for was optimism. Was a way in this to find, and it kind of goes to self-preservation, Jane, as well, looking through this horrendous, horrible stuff. And a lot of what, Kerry, in a lot of your stories, there's even a hint of a smile on your face throughout the horrible, terrible stuff. So I wonder if you could sort of address those two questions. The one is involvement, and then the other is optimism. Thanks.
I think it's hooked up to, but why don't you step over?
When it comes to reporter involvement, there is this kind of old school belief that you are an observer and it is not your job in any way to get involved. But when I see a human life that is there, I'm a human before I'm a journalist, and I'm going to do what I think is the right thing that should be done, even if in that particular case, you know, we knew he was a Serb because our translator told us that. If he had been an ethnic Albanian, I would have done the same thing, even if it would have brought on the wrath of the Serb government that at the time was chasing me. Perhaps the most dramatic example I have of getting involved against the rules was in Iraq. I was embedded with the Marines during the invasion into Iraq, and as the wounded were brought in and they were laying on stretchers, we were live on the air, and we went over, and I was talking to one of the young Marines, a Lance Corporal, who had been shot. The doctor was there, and I said, "Can I talk to him?" And he's like, "You can talk to him now before I give him the morphine, because once I do that, he's not going to be any good." And here's a 19, 20-year-old guy laying there who's been shot, not sure he's going to be alive or dead. And I'm like, "Is there anything that you want to say?" And he goes, "I just want to tell my mom something." And at that moment, I said, "You know what? I have a satellite phone in my pocket." And I took that phone out. I said, "What's your mom's phone number?" I dialed it, and I gave him the phone. I didn't say, "Hang on a second, here's a call." I just gave him the phone and let him talk to his mom. The military went ballistic because there was not supposed to be this connection from the field to somebody back in Houston talking to their mother as he's laying there. But I was sort of like, this is a human thing that you would want to do. I don't know whether he's going to survive or not. He wants to talk to his mother. And I just handed him the phone. At the end of the day, he survived. It became a very big story on NBC News, and the Pentagon, for the first time, had to rethink about, when we said we're going to embed reporters, we didn't think about some of the wrinkles associated with that, and turned out to be a happy story. But I have no problem getting involved. I think that we're there. You know, in Katrina, there was I was the first person at the airport to report at Katrina. Now, this is where they were bringing in as many people as they could from the nursing homes and everything else. And there was a man there's a sea of bodies. It's like all over the place on the baggage belts, on the chairs, on the floor, just everywhere. And I heard this cry from an old man that you could barely hear, "Help, help." And I went over there. Now, the first responders who were there and the military that were there, they just couldn't attend to everybody. And here's a guy who needed something to drink. So went over, gave him something to drink. The cameraman shot me doing that. I explained in the story that there were just so many victims. In some cases, this man who was old, disoriented, and couldn't barely even tell me his name, much less else, that we gave him this water. His family saw that on the air. And in the chaos, they were bringing bodies in, and then finally the military got its airlift and started taking people out, but the records were a mess and nobody knew where this guy went. And his family saw him on the air, which allowed us to try and track as best we could to where he went. And eventually they found him. They were able to talk to him on the phone. He passed away before the family got there, but they've said that it made them feel comforted to know that in this sea of bodies, somebody stopped to care about him, one individual. So, as a reporter, I think that it's just human nature.
Jane, Kerry, at some point, you get a phone call from the desk in New York, and they say, it's time to leave. How do you deal with that? How do you feel?
Well, like Kerry said, preparation is key. And, I happened to be at work the day that after the Haiti earthquake happened on January 12th. On the 13th, we realized the scope of it, and I'm sitting at my desk at 3 o'clock, and our boss calls and says, make a flight for 8 o'clock to the Dominican Republic. So immediately, we're trained to think first, what is the currency in the country where we'll be going?
Let
Money.
me interrupt.
Sure.
I'm talking about at the end of this, when they call you and say, we're moving on.
Oh, at
It's
the
time
end.
to come home.
At the end. In Haiti, it's hard not to become personally involved when you see things like that, when you meet the people. I was reluctant to come home. I didn't want to come home. Like, part of me wanted to go home for the comforts of home. Physically, I was exhausted. Emotionally, you're exhausted. But you become very much a part of the situation there. I don't, I'm sure Kerry feels the same way, and that's why, I kept asking to go back and subsequently went back 3 times. You feel sorry for the people, your heart breaks for them, and you want to continue to tell their stories. And so often in the news business, we have to move on, and it does become heartbreaking when one disaster is left for another, and you know that people will continue to suffer and not maybe get the supplies and aid that they need because we're no longer there to tell their stories.
Yeah, I'm proud. I always like to be first in, last out. That's my goal. First in because you want to be there and sort of assess the situation with your own eyes and tell that story. Last out because you then have the evolution of the story and you can refer back to things. My departure from Haiti had nothing to do with a call from New York telling me to come home, because after my first 2 weeks there, I had to come home for 48 hours because I was now completely out of clothes. And so I took after 2 weeks, I took all my clothes, I got a bucket, and I washed all my clothes, and I put it up on a line. And I went to sleep in the tent. And when I woke up the next morning, everything was gone. So I have no ill feelings because people had nothing. They needed clothes, and so have at it. You can have my clothes. But now I had 0 clothes, and the fortunate thing was that we had reinforcements that arrived. I could go home for 48 hours and restock my clothes, and thankfully the airport was open. And while the planes are arriving full with medical supplies and people, the military airlift was getting most of the people out. Those planes were going back empty. I literally, this will never happen again in my life, I literally went to the airport and I thumbed a ride on a G5, which is what, the billionaires have. And I thumbed a ride back to Fort Lauderdale on this G5, got some clothes in 48 hours, made my way back on a flight that was paid for by the Church of Scientology. They were buying planes to take people in to help. So, it really requires you to have the ability to move and shake. But yeah, you want to stay, you don't want to leave.
It's such a weird situation because literally we're sleeping on the tarmac at the airport, and then we moved to sort of a damaged hotel, and everybody was sleeping in tents around the wreckage of this hotel. It was secure. And you have a plastic bag to do your business in, and you're eating, whatever you can scrounge. And then the next day, like Kerry said, I was in a similar situation. We were able to get on a charter that was going back to Miami after having dropped off supplies. So, at 6 o'clock in the evening, you're packing up from this horrendous disaster coverage, and at 10:30 you're in the, Marriott Miami, with a down comforter on you, having room service, and it's such a disconnect, and it's sort of hard to reconcile sometimes and not leave a part of you there. I left everything that I could there, gave to some women, whatever clothes, my sleeping bag, shampoo, they didn't have anything, nothing. So I just left with my backpack and what I had on.
My favorite part about where we were living in those earliest days was we decided to set up at the airport because at the end of the day it also provided us some protection. So we are sleeping on the hard concrete, and the producer and I, we set up a tent, and trying to be American respectful of each other. It's a guy and a girl, and she decided, well, the tent's there and the sleeping bags, there. I haven't seen Kerry for a little bit, and somebody drove by in a vehicle, and there was a silhouette inside the tent. And so she said, oh, Kerry must have already gone to bed. I'll just sleep out here on the tarmac. I didn't want to encroach on her, and so I was actually off to another part of the tarmac already sleeping. She had seen a bag inside the tent. And so for the first night, we're both like morons sleeping outside, trying to be respectful of each other. And we slept on that concrete for, I want to say 6, 7 days, which is hard as a rock. And the planes are coming, and when the military planes come, they never shut down their engines. And so it's very, very, very loud, and it's very hard to sleep if you're going to get any sleep at all. And finally, somebody had the idea that we'd move out to the end of the runway. There was some grass, and we'd move out there. And I was like, oh, this is great. So we moved the tents down there. It's going to be soft. We're going to sleep on the grass and everything else. And right before I crawled into my tent, I looked over, and I saw the rats. And I was like, oh, no, we're moving into where the rats are.
Kerry Sanders, Jane Derenowski. Let's try one more quick question. Just one. But then we need to break. Very quickly, please.
I got a mic. My question is for Kerry and Jane. I'm in public health and not in journalism. And Kerry, you said that you're talking about your mission when you go into places. I just was curious, what exactly is your mission as a journalist, especially when you're there before the first responders? Is it just what's going to get in the news, what the people want to see, what they need to see, or, is it something more specific? What exactly is your goal?
It is pretty basic: who, what, where, why, when. That's pretty much what our job is. We're fortunate at NBC News because we have MSNBC, and so sometimes it is the news literally developing in front of you if you're live on the air, and we try to carry that transmission gear with us.
My job, my mission is, somebody like Kerry is the storyteller. My mission is to just make sure things run smoothly in the background, make sure the videotape gets fed to wherever the story is being edited, logistics, make sure my crew is well fed, so that they can continue to have the energy to do their jobs, and just sort of be in the background and make sure things run smoothly.
Rapid fire, please.
One more?
One more.
I'm John Simon from Public Health, and my question is also about choice of stories. Kerry, you showed the clip of the girl with tetanus. Tetanus was unrelated to the story you went down to cover, which was the disaster. And the response, and the reporting of the response, led to a very expensive choice to create a private air ambulance to take that child to Philadelphia. And my question is really, how about if we turn that off and I speak loudly?
Yeah.
My question is really about the underlying messages you send to the American people about what is a hero and what is an appropriate response in an epidemic. When from a public health point of view, I might look at that and say, that's 1,000 people's food and water. That's
Right.
5,000 people's malaria treatment. Instead, we get in the evening news a private air ambulance of an individual child sent to Philadelphia for a disease unrelated to the disaster.
Although the tetanus in this case she got as a result of being injured and scratched in the collapse of a building. But I get your point. The focus, it's a good question, and it's probably a very good thing for us to have some introspection on. At the hospital, the focus of that story was you will care more as an American, and I'm not asking you to care like and donate. That's not my job to tell you to give money. You will care and understand the crisis that's taking place much better if I say Bettina's legs are stiff and the doctors say she's going to die within 24 hours, as opposed to saying there were 375 people who were brought in here in the last hour, and there's expected to be another 375 in the next hour, and another 375 in the next hour. And it becomes sort of this statistical, overwhelming, I don't get it, I don't relate, I don't know much about what you're talking about. In the question of the amount of money that was spent for that girl and the two others, I would argue, you know, somebody survived because somebody found the money to get that. The emergency medical supplies, of the water, of the medicines that were needed, it would be real easy to say that the $150,000, I make that number up, for that plane to come down and get her back could have been $150,000 that went to something that would have benefited more people. But actually, it doesn't really work that way. It's not like the money all goes to a central pot and then we, as you all do in the medical profession, triage who's going to survive, who can wait, and all those sorts of things. So I respect the question. It's probably a good one for us to think about. It is the story that developed in front of me that I thought was the most compelling of the moment, because this was a child who was going to die within a period of time with a disease that doctors in the United States never deal with, and never would have expected that it had a happy ending based on what they were telling us.
And it's one of the things we learn in journalism is that it's very hard to get your lens on an entire catastrophe. It's the tight shot that brings that story home. Kerry Sanders, Jane Derenowski, thank you.